Hi, it's John Kuruvilla again, talking to you from Montreal in the more recent CHC meeting that we're holding in April. The lunch symposia that I presented today looks at the topic of early treatment in follicular lymphoma. So this is one that's quite interesting to clinicians and for patients alike because the decision making here has grown more complicated over the last few years, with treatments improving substantially both from an effectiveness and from a patient tolerability standpoint. This raises the question again, should we be treating people earlier in the disease course? So there are a couple of studies now available in the rituximab era that show that early intervention with rituximab is potentially of benefit. In the end, though, when you look at the most important endpoint, which is overall survival does not appear to be altered by the addition of rituximab in asymptomatic patients with low tumor burden. That being said, the important question still remains, what is the right time point to intervene on a patient? There are some criteria that are very clear: patients with symptoms, patients with large amounts of disease, but the gray zones still exist, and I think those are the areas that clinicians struggle with. And in this session, we had an open discussion about defining the role of when treatment should start, accepting that this is a moving target, and as treatments are more effective, clinicians may be more comfortable starting to use these treatments in patients a little earlier.